Okay, so headaches are a common presenting complaint in older children and adolescents. The most common causes of headaches include febrile illness. Are you able to see this? Febrile illness, ENT, including ENT involvement, migraines, and tension headaches. Some less common causes of headaches include meningitis, space-occupying lesions, subarachnoid hemorrhage. Even though these are less common causes of headaches, it's important to always consider them, because if they do present, then this can be life-threatening. So a good way of remembering the different types of headaches is understanding the various patterns that there are to headaches. So this is a table which I found, which shows the various patterns. So you can have acute recurrent headaches, and acute recurrent headaches, you can see, are often a sign of a migraine. So usually it's a migraine if it's an acute recurrent one. You can have chronic non-progressive, can you see that? Chronic non-progressive headaches. So these include tension headaches. Can you see that? Tension headaches, those caused by anxiety, depression, and somatization. So don't forget that. You can have chronic progressive headaches, and chronic progressive headaches suggest a underlying pathology, so such as a tumor, intracranial hypertension, brain abscess, hydrocephalus. So you definitely want to investigate those ones. And you can have acute on chronic headaches. So that's usually suggesting that it's a tension type headache with a coexisting migraine as well. So there's more than one thing happening there. Okay, some important red flags for you to look out for when you're taking a history include the following. Can you see that? So you want to watch out for any headaches that are acute and severe, progressive and chronic. There's focal neurology, any headaches in a child that is less than 3 years old, headache / vomiting on waking up, recurring headaches which recur in the same location, and headaches which are associated with hypertension. So the main types of headaches that you will come across are tension and migraines. So tensions, I think this is the most common presenting type of headache. This is usually bilateral, and it's described as a band-like pressure. It's often worse in the evenings. Migraine is essentially a headache which can be both bilateral and unilateral. And with this type of headache, you can get photophobia and phonophobia, that's sensitivity to sounds. And you can also get nausea and vomiting, and migraines can last anywhere between 1 and 72 hours, and maybe preceded by an aura. So in about 10% of cases, it's preceded by an aura. So that can be a negative phenomena, whereby you get a hemianopia, problems with your vision, or it can be a positive phenomena. So you get added spectra, such as you might see zigzag patterns. So those are the main causes of headache, but you want to watch out for other ones. So such as fever, headaches which are associated with fever without meningism. So watch out for the upper respiratory tract infections here and pneumonia and septicemia. Headaches can occur as a result of local sinusitis, so you're going to watch out for any facial tenderness at all, so when you're pressing on their face, and look in the ears for otitis media. It's important to ask whether there's been any recent head injury as well, because you can get headaches associated with concussion, etc. And then again, be looking out for signs of meningitis. So with meningitis, you might get a decreased level of consciousness. You can get irritability, appearance of purpura or / bruising on the skin, neck stiffness, photophobia. Now, just to mention, in young children, often the classic signs are not present. So if you don't see the classic signs, it's not necessarily, well, you shouldn't necessarily rule out meningitis. And subarachnoid hemorrhage is another cause of a headache, and it's described as a thunderclap headache because it's just sudden onset, and it's often you often get vomiting associated with that, or at least nausea. So if you suspect intracranial pathology, then do a CT or MRI. Or in the case of younger children whose fontanelles are still open, you might want to do an ultrasound to check for pathology. So how are we going to manage? So in terms of managing, you might want to make adjustments to the environment. So for example, if there's things that triggered a migraine, then change that. Then of course, simple painkillers. Oh, actually, this is for management of a simple headache. So environment, changes, paracetamol. You might want to give antiemetics if there's nausea. Now with migraines, for children who are less than 12 years old, you may want to consider giving them ibuprofen or chlorpromazine. And for children who are older than 12 years old, you may want to consider giving them aspirin and a triptan, and again chlorpromazine.